How is an awake craniotomy performed with precision? Imagine being awake during brain surgery, helping your doctors remove a tumor while they make sure your vital functions stay safe. That's exactly what an awake craniotomy is all about. It's a highly precise procedure that combines advanced technology, careful planning, and patient cooperation to remove brain tumors near critical areas. The goal is to get as much tumor tissue out as possible without damaging important parts of the brain that control speech, movement, or thinking. The process starts long before the surgery with detailed imaging scans like magnetic resonance imaging and computed tomography. These scans help the surgical team pinpoint the exact location of the tumor and plan the safest route to access it. Once in the operating room, the patient receives local anesthesia to numb the scalp and skull. Sedation may be used initially to help relax the patient, but it is carefully managed so that the patient remains awake and responsive during key parts of the operation. Next, the surgeon removes a small section of the skull, called a bone flap, to expose the brain. At this point, sedation is lightened or stopped altogether, so the patient is awake but still comfortable. This allows the surgical team to perform brain mapping by applying tiny electrical stimulations to specific brain regions. When stimulated, these areas can cause responses like muscle movements or speech changes. The patient actively participates by performing simple tasks such as counting, naming objects, or moving limbs. This real-time feedback helps identify and mark critical areas that must be preserved. Throughout this process, a neuroanesthesiologist closely monitors the patient's vital signs and comfort levels. They adjust sedation and manage pain carefully to keep the patient awake but safe. The surgical team then uses advanced tools like neuronavigation systems and electrophysiological monitoring to guide the surgeon precisely. These tools provide real-time feedback on brain activity and help avoid damaging important functional areas. Once the tumor is carefully removed, the bone flap is replaced, and the scalp is stitched up. After surgery, the focus shifts to recovery, with monitoring of neurological functions and pain management. The success of an awake craniotomy depends on the collaboration of a skilled team of neurosurgeons, neuroanesthesiologists, and the patient. This approach allows for maximal tumor removal while protecting brain functions, especially when tumors are near areas that control speech, movement, or cognition. In essence, performing an awake craniotomy with precision involves meticulous preoperative planning, real-time brain mapping with patient participation, advanced monitoring technology, and expert teamwork. It's a powerful method that offers hope for better outcomes in brain tumor treatment, helping preserve quality of life and brain health. Always remember, if you or someone you know is considering this procedure, consult with specialized medical professionals to understand the best options tailored to individual needs.